Unacademy. Let's crack it.
Right. Today we are starting a review lecture on cardiovascular system physiology, right? And first of all, there's introduction to cardiovascular system, and after that we are going to the circuit of cardiovascular system through which the blood flows. Before I go into circuits of the blood flow, that is pulmonary circuit and systemic circulation, before I go there, I want to just make a little review about the basic structure of the heart, right? So, first of all, let me draw the right side of the heart, and here is superior vena cava, and yes, and here it is inferior vena cava, yes, superior vena cava, inferior vena cava, right? Both this caval system is bringing the blood from all over the body, right, except lungs, right? And this blood is venous blood, mixed venous blood with low oxygen and high carbon dioxide. Now, this blood is going from here to the right atrium, and then there is a structure which is one-way valve. This is basically your tricuspid valve. Through the tricuspid valve, the next chamber which is there is right ventricle. This is right ventricle, right? So, let me draw these things. Number one, this is a valve, and this valve is basically between the right atrium and right ventricle, and this valve is called, yes, tricuspid valve, tricuspid valve, right? Now, other important thing is that right ventricle, that when it contracts, it pushes the blood through another valve, and that valve is, yes, that is pulmonary valve. What is that? That is pulmonary valve. Pulmonary valve. Now, from here, the blood will go to the lungs, and there it will get oxygenated, lose the carbon dioxide, gain more oxygen, and then blood will return to the left side of the heart, right? Let me draw the left side of the heart. Now, for left side of the heart, this is left atrium, this is left, yes, ventricle, and this is outflow of left ventricle, which is basically aorta. Now, if here we make the valves, this valve between the left, yes, between the left atrium and between the left ventricle, this valve is basically mitral valve. And other valve is between the left ventricle and aorta in the outflow of the left side, and this valve is called, yes, what is this called? Aortic valve, right? So, basically what we see here, a very simple structure of the heart, right, where there is right side of the heart and there is left side of the heart, right? And after that, in diagrams, I will show these right side of the heart separate and left side of the heart separately, because when I am going to show you pulmonary circulation and systemic circulation, right? So, for simplicity purpose, I will separate right side of the heart and left side of the heart, right? So, let me draw now that structure. And we will see that how the blood flow moves through. First of all, let me draw here right side of the heart, right? Now, as you know, this is superior vena cava, inferior vena cava, right atrium, tricuspid valve, right ventricle, and what is this? Pulmonary valve, right? Now, this is what really happened if we say from where the pulmonary vasculature starts. Listen, pulmonary vasculature, the beginning of the pulmonary vasculature is from this valve onward. From this valve onward, what was this valve? Pulmonary valve. So, basically from pulmonary valve, right, and beyond that, we are moving into pulmonary vasculature. But who is pumping the blood into pulmonary system? That is the right ventricle. So, if we go into detail of pulmonary circulatory system, circulatory system, pulmonary circulatory system, if we talk about this, right, first of all, there should be a pump, right. Now, the pump of pulmonary circulatory system is right, yes, what is it? That is right ventricle, that is right ventricle. This is the pump, major pump for the pulmonary circulation, right. Then after that, pulmonary vasculature. The second part is pulmonary vasculature. Pump, pulmonary pump, then pulmonary vasculature. I will draw now pulmonary vasculature. Now, pulmonary vasculature. Pulmonary vasculature, as I mentioned, that it is starting from the pulmonary valve and vascular system which is extending from here into lungs, right. And let me draw the lungs. Let's suppose that this is our pulmonary tissue, right. So, this structure is representing both lungs, right. Now, what happens? That blood from the pulmonary system through the pulmonary trunk, right. What is this? This is pulmonary trunk. Then it will divide into, pulmonary trunk divides into right and left major pulmonary arteries, right. Of course, right pulmonary artery is going to the right lung and left pulmonary artery is going to the left lungs. I will just catch one to show that. Now, this pulmonary artery, as it enters into pulmonary tissues or lung tissues, it progressively divides into smaller vessels, smaller arterial vessels. Now, what has happened? That there were pulmonary trunk, then there were major pulmonary arteries, then there are lobar arteries, right? Then further smaller arteries. Eventually, the last part of pulmonary arterial system is pulmonary arterioles. So, let us suppose this is representing pulmonary arterioles. Now, pulmonary arterioles drain into, yes, they drain into pulmonary capillaries. What is this? This vessel is pulmonary capillary, and pulmonary capillaries, they are actually surrounding the alveolar system for gas exchange, right. These are the pulmonary alveoli or air sacs where the air goes, right. Now, this is the point where basically exchanges occur, and yes, carbon dioxide is lost from pulmonary capillaries to the air spaces, right, or alveoli, and from alveoli what we take? Oxygen, right. So, what is happening? In capillaries, this is capillary, right, and capillaries of pulmonary system, right, pulmonary vasculatures, they are surrounding the alveoli, and they are very thin, of course, so gas exchange is going on. So, what is happening? That blood is losing the carbon dioxide and gaining the oxygen, and blood becomes well oxygenated. Blood becomes well oxygenated. So, what are these? Yes, pulmonary capillaries. Now, pulmonary capillaries, they get the blood oxygenated, and then oxygenated blood, yes, right. These capillaries will unite together, right. These capillaries will unite together and they will make, what is this? Pulmonary vein. What is this? Pulmonary vein, right. Now, what has happened really? That in the pulmonary capillary system, right, gas exchange occurred, and now more oxygenated blood is moving through pulmonary venous system, right. And when pulmonary blood is moving through the pulmonary venous system, yes, I should draw that. Pulmonary venous system will eventually drain into left side of the heart. Now, pulmonary venous system, it is going to the left side of the heart. Now, what will happen? These pulmonary capillaries will go into pulmonary venules, and then venules will come together and they will make smaller pulmonary veins, then larger pulmonary veins, and eventually the largest pulmonary veins will drain into, what is this? Left atrium. They will drain into left atrium. And now this blood which is coming into left atrium from the pulmonary system, right, this is more oxygenated and low in carbon dioxide and high in oxygen. Now, let's see a very important thing. If we talk about pulmonary vasculature, that starts at, what is this point? Pulmonary valve, and it also includes all pulmonary arterial tree, and then it includes pulmonary capillaries, the diffusion points, and then it becomes together and pulmonary vasculature convert into pulmonary veins, and pulmonary veins drain into left atrium. And how many pulmonary veins drain into left atrium? Actually, there are 4. 2 coming from the right lung and 2 are coming from the left lung. So we can say, if we make, what is this? Left atrium. So we can make it 4 areas. And what is this? Pulmonary veins. And these veins are coming from, yes, these veins are coming from, what is this? This is coming from the right heart, and these are coming from the left lung. This is coming from the right lung, and they are coming from the left lung. So actually there are 4 openings in the left atrium, right? These 4 orifices are basically pulmonary veins, but these are the veins which are bringing the blood which is well oxygenated, Now, this is the final point where pulmonary blood will reach, right? Now, when we talk about pulmonary vasculature, that extends from pulmonary valve, right? Pulmonary arterial tree, pulmonary capillaries, pulmonary venous system, and eventually it drains into, yes, final drainage of pulmonary blood flow is in left atrium, right? And that is the final drainage, and also it acts as a reservoir, right? So pulmonary vasculature is up to this point, right? What is this point? Up to these openings, right? But when we say pulmonary circulatory system, there is a difference between pulmonary circulatory system, circulatory system. There is a difference between pulmonary circulatory system and pulmonary vasculature. Pulmonary vasculature. Now, what is the real difference between them? What is the difference between pulmonary circulatory system and pulmonary vasculature? Actually, when we talk about pulmonary circulation or pulmonary circulatory system, we should include, number 1, what is here? All vasculature and major pump, right? That is right ventricle. So it has basically pulmonary system, it has how many components? First is the pump, which is right ventricle, right? Number 2, blood is going into pulmonary vasculature, and eventually final drainage. Drainage is left atrium, right? So we can say, when we are talking about total pulmonary circulation, we have to talk about the pump of pulmonary system, vasculature of pulmonary system, and final drainage of the pulmonary system. So we can say pulmonary circulatory system consists of how many components? 3 components. 1 component is from the right heart, that is right ventricle. Second component is pulmonary vasculature, which is consisting of arterial tree and then pulmonary capillaries and pulmonary venous system. And finally, last component where they drain, and that is the left atrium. So actually we can say that when we are talking about pulmonary vasculature, we are just talking from pulmonary, what is this, valve, up to, what is this, these points, pulmonary veins drain. This is all vasculature. But when we talk about pulmonary circulatory system, we include the pump. The pump is right ventricle, and we include the drainage system, which is final drainage, which is left atrium. Is that clear? So this is pulmonary